Hey everyone, welcome to our vlog. My name is Kiara and this is my partner.
Hello guys, my name is Marty.
We are third year nursing students from Negros Oriental State University here in Dumaguete City, and for our psychiatric nursing, we are going to talk about personality disorder. First off, what is personality?
Personality is defined as the totality of emotional and behavioral characteristics that are particular to a specific person and that remains somewhat stable and predictable over time.
Now we have an understanding about personality. Then what about personality disorder?
Personality disorder, according to Diagnostic and Statistical Manual of Mental Disorders 5th edition, or DSM-5, and American Psychiatric Association, or APA, is defined as an enduring pattern of inner experience and behavior that deviates markedly from the expectations of the individual's culture, is pervasive and inflexible, has an onset in adolescence or early adulthood, is stable over time, and leads to distress or impairment.
Then you might be wondering, how many people tend to have this type of disorder?
Personality disorders are relatively common. It occurs in 10% to 13% of the general population. 15% of all psychiatric inpatients have a primary diagnosis of a personality disorder. 40% to 45% of those with a primary diagnosis of major mental illness also have a coexisting personality disorder that significantly complicates the treatment. And in mental health outpatient settings, the incidence of personality disorder is 30% to 50%. Clients with personality disorders have a higher death rate, especially as a result of suicide attempts, accidents, and emergency department visits. They also have an increased rates of separation, divorce, and involvement in legal proceedings regarding child custody. Personality disorders have been correlated highly with criminal behavior. 70% to 85% of criminals have personality disorders. Alcoholism, 60% to 70% alcoholics have personality disorders. And drug abuse, 70% to 90% of those who abuse drugs have personality disorders.
How do we diagnose personality disorder?
Diagnosis is made when the person exhibits enduring behavioral patterns that deviate from cultural expectations in two or more of the following areas: ways of perceiving and interpreting self, other people, and events, or cognition, range, intensity, lability, and appropriateness of emotional response or affect, interpersonal functioning, and ability to control impulses or express behavior at the appropriate time and place, or impulse control.
So then, what type of assessment and diagnostic tests do we have to undergo?
Assessment and diagnostic findings. The following tests can be used in the diagnosis of personality disorders. Toxicology screen. Substance abuse is common in many personality disorders, and intoxication can lead patients to present with some features of personality disorders. Screening for HIV and other sexually transmitted diseases. Patients with personality disorders often exhibit impulse control and may act without regard to risk. Such behavior can lead to infection with a sexually transmitted disease. CT scanning. Computed tomography scanning with appropriate blood work can be carried out if organic etiology is suspected. And radiography. Radiography can be indicated for injuries from fighting, motor vehicle accidents, or self-mutilation.
There are 10 types of personality disorder and they are arranged in 3 clusters. The specifications of these personality disorders will be discussed in the next video. Just click the link in the description below.
Types of personality disorder. Cluster A, the odd and eccentric. These are paranoid, schizoid, and schizotypal personality disorders. Cluster B, the dramatic, emotional, and erratic. These are the antisocial, histrionic, narcissistic, and borderline personality disorders. and cluster C, the anxious and fearful. These are the avoidant, dependent, and obsessive-compulsive personality disorders.
We all know that nursing management is essential. So here are some nursing interventions that may help you in dealing with personality disorder. Next is we have medical management. Combinations of medications and individual or group therapy are more likely to be effective than is any single treatment.
Several treatment strategies are used on clients with personality disorders. These strategies are based on the disorder's type and severity or the amount of distress or functional impairment the client experiences. Treatment team includes primary physician, psychiatrist, psychologist or other therapist, psychiatric nurse, pharmacist, and social worker. Individual and group psychotherapy. Therapy helpful to clients with personality disorders varies according to the type and severity of symptoms and the particular disorder. Cognitive behavioral therapy has been particularly helpful for clients with personality disorders. Relaxation or meditation techniques can help manage anxiety for clients with cluster C personality disorders. Improvement in basic living skills through the relationship with a case manager or therapist can improve the functional skills of people with schizotypal and schizoid personality disorders. Assertive training groups can assist people with dependent and passive-aggressive personality disorders to have more satisfying relationships with others and to build self-esteem. Dialectical behavior therapy, or DBT, was designed for clients with borderline personality disorder.
Medications are in no way curative for any personality disorder. They should be viewed as an adjunct to psychotherapy so that patients may engage in the therapy.
The following drugs are commonly used on patients with personality disorder. We have lithium, anticonvulsants, antipsychotics, cholinergic agonists, imipramine, carbamazepine, phenytoin, benzodiazepines, monoamine oxidase inhibitors or MAOIs, selective serotonin reuptake inhibitors or SSRIs, and atypical antipsychotics.
So that's it for the part 1 of personality disorder. We hope you learned something from us. See you next time!
My darling, I love you, I love you, I love you, I love you.